Good afternoon, Penn Staters, and thank you for joining us. John Petitschnok here, welcoming everybody to today's discussion that focuses on innovations in research in addressing substance use disorder stigma in Pennsylvania. Closed captions are available. You can access them by clicking the closed caption button at the bottom of the Zoom window and then clicking Show Subtitle. You can also customize your caption view by clicking the stream text link posted to the chat. And we're live streaming today's presentation, which will be archived on our website in the near future. Today's guests join us from the Douglas W. Pollock Center for Addiction and Research, based in Penn State Harrisburg, and we'll hear shortly from Dr. Weston Kensinger, director of the center, and from several colleagues on his team. In 2020, more than 20 million adults in the United States were reported to have at least one substance use disorder, surpassing vehicle accidents as the #1 cause of accidental death. Worsening that of individuals who need substance use treatment, only a small portion receive it. While many factors are barriers to effective access to treatment, stigma toward individuals has significant negative impacts on the health, recovery, and lives of people with the disorder, and today's guests will discuss efforts to understand and address that stigma. Good afternoon to you, and thank you for joining us, Dr. Weston Kensinger.
Great. Thanks, John. It's great to be here. And thank you, everybody, for joining us. So we're going to be talking about some innovations in research and addressing substance use disorder and stigma in Pennsylvania, and our work that we do with the Douglas W. Pollock Center. Next slide, James. James, can you click through the next slide?
Sorry, 1 second. I apologize. Is it on the right? Can you see my screen?
Yeah. Can we go to the second slide?
Am I on the right one?
Yeah. Hit at the top from current slide. Just go down to the second slide.
I'm clicking from current slide. And
okay, can you just click on the slide below, center background?
Sorry here. Can you see my screen?
Yeah. It might be easier if I just share the slides here.
Yeah.
Yeah, so I just sent. Can you see my slides now?
Yep, we can see your screen.
All right, great. So we established a center back in 2019, so about 6 years ago, and it was established with a $2.5 million leadership endowment from the Douglas W. Pollock Foundation. And really what perpetuated this was my best friend died of an overdose, and I said, how can I help? All right, we have all these resources at Penn State. How can I take what I do on a daily basis and really help people who are suffering with a substance use disorder or have a friend or family member with a substance use disorder? So I work with the development office here at Penn State Harrisburg. We identified the Douglas W. Pollock Foundation, and they were generous enough to provide a leadership gift so that we could start the center. So the center takes an interdisciplinary approach. We're collaborative, and we work with community-based organizations, right, to really help provide them with the supports that they need so they can be most effective in what they do on a daily basis, whether it's providing treatment, recovery services, or just support for people with a substance use disorder. And we take the approach knowing that, substance use disorder, addressing this isn't easy, right? It's something that's very difficult, and that there's no one organization that's going to do this on their own. It's not the role of police officers. It's not the role of researchers. It's not the role of state or federal government officials, right? It takes all of us to do. One of the things, that was said during the dedication of the center by Mike Banks, who's the head of the Douglas W. Pollock Foundation, was the center is going to be hands-on. We're not worried and not interested in an academic exercise. It's going to assist community groups, veterans groups, the courts, and any other organizations that are on the front lines of attacking and taking on this war of addiction. So unlike some other research centers throughout the university, right, we're not solely focused on research. Every project that we do is meaningful for the communities that we serve and across the state. We're very hands-on with what we do. All right, and we really strive to connect and strengthen stakeholders, which are organizations, individuals who are responding to this crisis, and really lead the effort both statewide and nationally. So we work with specific community organizations to assess their needs, right? We help them locate funding so that they can be successful. We foster collaboration between groups across the state so that there's no duplication of efforts. We provide up-to-date evidence-based research strategies for addressing substance use disorder, right? And we serve as expert level resources, right, for citizens across the Commonwealth as well as organizations. All right, so some of the ways that we do this, we have an ACE student lab, which Övgü is going to talk about in a little bit. We provide a service called SERVE, which is support, education, and resources for veterans. We host veteran coalition meetings, and we have an activity room for them. We work with local EMS and paramedics to help evaluate their efforts and what they're doing. We work with different police departments across the country, or excuse me, across the state, with arrest diversion programs, also with Pennsylvania State Police, which Nathan's going to talk about in a little bit. We host community events both on campus and off campus and across the state. And we work with over 360 different community-based organizations across the state, really helping to coordinate their efforts and providing them with the resources that we can so that they can be most effective. We have webinars that we host on a monthly basis. We also collaborate with nonprofits, PGP and Shatterproof on some of our larger projects, and Eric's going to talk about that in a little bit. And our largest project is the Life Unites Us Stigma Reduction Campaign. So this is Pennsylvania's Stigma Reduction Campaign, where we've already reached over 8 million Pennsylvanians to reduce stigma with substance use disorder. Of course, there is a research aspect to this. So far, we've published 13 peer-reviewed articles, we have 3 more under review. We have 4 in progress and also a book chapter. We've presented over 40 times at local, state, national, and international meetings. 28 data briefs have been published and 31 reports to sponsor. Now, I don't do all this work on my own. We have a great team who really helps to facilitate everything and gets everything done. So I might be the director. None of this work gets done without any of them. So our team is comprised of myself, Erica Saylor, who's our research associate, Övgü Kaynak, who's an associate professor in psychology, Chris Whipple, who's an associate professor in psychology, and Nathan Cruz from Penn State Altoona, who's an associate professor in criminal justice. So I'm going to turn it over to Erica to talk a little bit about the Life Unites Us campaign.
Thanks, Weston, and good afternoon, everybody. As Weston mentioned, I'm going to be talking a little bit about Life Unites Us today. In 2020, Pennsylvania was the first state in the country to establish a statewide stigma reduction project, and it's funded by the Pennsylvania Department of Drug and Alcohol Programs, and the Pollock Center collaborates with national nonprofits, Shatterproof, and the Public Good Project. And really, the premise of this work is based on research that has demonstrated that humanizing and putting a face to substance use disorder can actively assist with reducing stigmatizing beliefs held by individuals. This project specifically collects stories of recovery from real-life Pennsylvanians from all across the Commonwealth. The goals of the project are to increase knowledge that substance use disorder recovery is not only possible, but probable, improving attitudes towards people living with SUD or people in recovery. As Weston mentioned, this aligns really well with us, strengthening capacity of stakeholders and supporting community-based organizations, and then evaluation and research of the effort as a whole. Next slide, please. As I mentioned, the campaign side of the project uses a contact-based approach, so really sharing and highlighting these stories of hope and resiliency to break down that stigma. The campaign hosts a very large story library on its website, and utilizes those stories and also static and dynamic images, tiles, and montages on social media to really push out those key messages. And this is done through both influencers and also a paid and organic media strategy. Next slide. This slide is super busy, and so bear with me while I work through it, but I wanted to utilize it to really showcase the intricacies and complexity of the project. Most people involved with Life Unites Us kind of see the public-facing side of things, the campaign, and understand that piece of it really well, but don't necessarily understand the full complexity of all the pieces that work in tandem with that. So the digital media side of things is kind of all the pieces out there publicly. The project also has a large repository of community-based organizations and also resources for them. So we provide newsletters, webinars, data briefs, a data portal. We have a mini grant award program, and we also have an advisory board called the Community Impact Committee, or the CIC. Additionally, the project conducts robust mixed methods evaluation and research that includes literature reviews, in-depth interviews, and focus groups with stakeholders, and then statewide public surveys. And the research component and evaluation components not only monitor the infiltration of the campaign, but also assess how Pennsylvanians view stigma and related SUD issues such as harm reduction measures or policy change. And all of these many pieces feed into one another, allowing feedback from each piece to change and pivot and make adjustments in any other respective pieces. So for example, in the past, when we put out statewide survey results to our internal team, some of the media folks at PGP who handle all of the media pieces of this project noticed that there wasn't as much infiltration in a specific region of Pennsylvania, so they might ramp up, they ramped up paid strategy for that region. Or for example, we have meetings with our Community Impact Committee, our advisory committee, and they might help inform topics for webinars or data brief. So kind of all of these pieces really the flexibility and the feedback kind of allow for that fluidity for the campaign to pivot, make changes, and to really be successful to kind of move with the changes that we naturally see with trends and changes in substance use disorder, substances specifically, and then also just changing environment, politics, things like that. Next slide. So this slide is just a very brief diagram of some of the results and trends from our 42-month survey. Overall, with this iteration, we see folks who have interacted with the campaign in some way have less stigmatizing responses to a variety of questions from this sample. Additionally, since we've been collecting data, we've seen an increased willingness to obtain naloxone and increased agreement that harm reduction strategies should be available in PA. I do just want to mention none of this is causal, right? So we're just kind of taking pieces from specific points in time and kind of looking at them and what those are saying. But overall, very promising results and really, positive affirmation that the work we're doing is making an impact in the Commonwealth. Next slide. I provided a super high-level overview of our work. There's a lot more pieces that I could talk about for quite a while, as well as my colleagues. But with that, I'll just say if you have any questions about this, you can reach out to the Pollock Center directly. And I certainly encourage you also to check out Life Unites Us. The website is there, as well as all the handles for social media. And it's now my pleasure to turn things over to Dr. Whipple and Dr. Kaynak. Thank you.
Hi, everyone. Thanks, Erica. So Chris and I are going to be talking about the Pollock Center Student Lab, the Awareness and Community Engagement Lab. So we officially started the lab in its current form about 3 years ago, although we're kind of always thinking about how we can structure it to really be the most beneficial to our students. Through the lab, we aim to train both graduate and undergraduate students in research. So kind of from, forming a research question to analyzing and presenting data at meetings and conferences. And since we do have limited time with our students, right, we're talking about undergrads who might only be with us for a year or so, same with our graduate students who have kind of, they're mostly in tutor programs as opposed to a doctoral student who would be there a little longer. So because of that, that time limitation we have, we often have students use data that we've already collected, and they conduct secondary analyses. So through the lab, we mentor our students throughout the research process. We work as a team, really collaboratively, to create something meaningful that they can then include on their CVs. We also have students that come up with their own ideas. They come to us with ideas they may have. Sometimes they have an idea for a different type of analysis. Other times they just want to start their own project, and we also mentor them through that. When we can, we also engage students in service learning through community outreach. So in the past, students have been involved with activities, for example, that happen during Recovery Month, both on campus and elsewhere in the community. And that's, an aspect of the lab that we are continuing to develop. We've really made a concerted effort to recruit students who not only have an aptitude for research, but then also are engaged in the campus community in a variety of ways. We know that there has been research that looked at the benefits of engaging, especially undergraduate students in the research process. And, first of all, we know that students who participate in undergraduate research are more likely to apply to and attend graduate programs. They're more likely to keep their GPAs up. They're also more likely to stay in school, as opposed to drop out before completing their degree. We've seen firsthand that undergraduate research can help students figure out what they want to do next. So whether that's, applying to graduate school or going into the workforce, it kind of helps them make that decision. We've also found that our students in particular have expressed a desire to stay in the field of addiction after their research, after, their research experience. There's also a ton of transferable skills that students attain while doing research. In particular, obviously strengthening critical thinking skills, also written and oral communication. So our students get a ton of hands-on experience, hands-on practice with a lot of these, very useful skills that they'll take with them when they graduate. And then they also get, a community through participating in our lab. So we meet weekly in person. Our students work together as a team throughout the year, and they form real relationships with each other and also with myself and Dr. And then finally, confidence. Confidence is one that we see frequently. This is something that students talk about. They mention at the end of the year, we'll kind of look back and reflect on what they gained from this experience. They often said they come in feeling nervous and maybe a bit out of their league, but they always leave feeling extremely confident with the work that they've completed and also their ability to engage not only in the research process, but also, this kind of ability to be able to talk about their research with other people in the community. Next slide, but slide Dr. Wilkes about this.
So as Dr. Kaynak mentioned, we work with a lot of undergraduate and graduate students, and student success is a major focus of what we're trying to do in the ACE lab, not only to train future researchers in substance use and substance use disorder research, but to inspire and to strengthen their ability to engage in the community to support people with substance use disorders. We often work with students from a wide range of backgrounds and experiences and majors. Our undergraduate students come from psychology, from biobehavioral health, from other places, and they all bring in their unique perspectives, both perspectives from their training and from their lived experiences, often with friends, family members, people who have substance use disorder. In addition, a lot of our graduate students come from our clinical psychology graduate program. Many of them are planning to become clinical psychologists, and will eventually work with people with substance use disorder to enhance their recovery. We also work with students at the Penn State College of Medicine, either students who are in their training to become a medical doctor or in the public health program. Since 2022, we've trained 21 graduate students and 19 undergraduate students through our ACE lab. As Dr. Kaynak mentioned, we work with our students throughout the process to understand research, to understand substance use disorder, and to go through the research process and develop a research study, carry it out, and present it in some formal gatherings. Since 2022, we've presented 24 academic presentations. These include academic posters, oral presentations at these academic conferences, both locally within the university at Penn State Harrisburg and at University Park, but also in regional, state, national, and international meetings and conferences. Our students are heavily involved in putting these research projects together and submitting them for consideration, and in presenting them at the conference. And it's always exciting to see them present, often for the first time. They're super nervous, but they handle it really well. And at the end, they'll have a lot of good feedback and be able to talk about their experiences very clearly. Some of our lab students work with us to co-author peer-reviewed manuscripts. We've had 4 students who have assisted with those papers, and we've also had 4 students so far who have been accepted into doctoral programs. A lot of our students are engaging in the community through some of our community partners, primarily with our Life Unites Us partners, to support recovery in the region and to build the experience working directly with individuals with substance use disorder that will help them to become better researchers, better clinicians, and better practitioners. One of the exciting things that we have moving forward that Dr. Kaynak is heading up is this Family Resource Center. So I'll turn it over to her to talk a little bit more about that.
Yeah, thanks. So we're kind of in the beginning stages of this, but through the work that we've done with the Life Unites Us campaign, especially with a lot of the qualitative interviews that we've done with family members, it's really become very apparent that most family members don't know where to go when they have family member loved one with a substance use disorder. So looking for treatment for their loved one or even for themselves. They kind of are unclear as to where to go and who to talk to. So the idea here is to create kind of a master list of treatment centers, support groups, family-focused trainings that are available across the state, so that people will be able to come to the Pollock Center website and be able to look to see what programs and groups are kind of available in their community. So we're going to be working on that and creating a map, and some of our graduate students are going to be helping us with that.
Weston, next slide, please. Thank you. At the end of each semester, we ask our students to reflect on their experience with the ACE lab. We don't give much prompt. We just ask them to reflect, to tell us about what it was like. And we've added some quotes from some of our students about their experiences. And throughout these, you'll see the ability to develop new skills, but beyond that, the ability to connect with the problem, to understand the needs of people with substance use disorder, and increase desire to work to support them, to use their skills in the future and in their career to help people recover. So the first one, I found that the ACE lab has been one of the most interesting experiences of my academic journey. I had never had research experience before this lab, and I found myself constantly learning and cultivating new skills that I believe will be extremely important for me in the future. Another student said, "What surprised me most was how personally connected I feel to this work. As I learned more about the systemic barriers and human experiences behind the data, I have felt a growing responsibility to continue this kind of research. And lastly, another student said, at the beginning of the semester, I knew I could expect to learn a lot as part of the lab, but I did not predict the level of interest I've developed in the substance use crisis and associated public health issues. And I think especially those last two really highlight what we're trying to do. It's great that we are able to train future researchers, but what we really want to do is to develop a motivation and compassion for people with substance use disorder and a desire to use the skills that we can help them develop to increase the likelihood of success and recovery, to change stigma toward people with substance use disorder, and to kind of improve the lives of the people that they serve. With that, I'll turn the time over to Dr. Nathan Cruz.
Thank you, Dr. Whipple. Good afternoon, everyone. I'm going to talk a little bit about the opioid epidemic, its effect on the American criminal justice system, and some of the research that we've been doing in this area. So as John kind of hinted at, we are currently in the middle of a significant decades-long opioid epidemic in the United States. Use, misuse, and abuse of prescription opioids and heroin have reached what the CDC has labeled epidemic levels. And if you just look at some of the estimates on the screen there, about 3 million Americans currently reach the clinical diagnosis criteria for having an opioid use disorder, and about 500,000 are estimated to be dependent on heroin. When we look at overdose deaths, we've seen about a tenfold increase over the last 20 years, and now about 75% of all overdose deaths involve prescription opioids or heroin. And this epidemic has had a detrimental impact not only on our public health system, but also on our criminal justice system. If you look at some of the arrest data that's been coming out, about 1/3 of all arrests that are made annually would fall under what the FBI used to call drug abuse violations. And in that category, a significant number of those arrests involve either heroin or opioids. And consequently, a number of individuals who are dependent on opioids end up in the criminal justice system. They end up having encounters with our officers, being processed in the court. And then we need to address these issues whenever they enter the correctional system. And it's about 1 in 5 right now, individuals who end up in our correctional system, who end up incarcerated, report regular use of opioids. Next slide, please, Weston. Fortunately, the responses to this epidemic have been a little different than to some of the epidemics that we've seen in the past. We've seen the implementation of more harm reduction or harm reduction oriented policies, such as having officers and first responders carry and administer naloxone, having law enforcement agencies partner with treatment centers where they will divert people who use opioids and people who use drugs away from formal processing and get them into treatment. And then the use of medications for opioid use disorder, such as buprenorphine, methadone, and naltrexone. What is unfortunate, though, is that we have not witnessed ubiquitous adoption in the United States of these policies. If you look at naloxone, not every law enforcement agency in this country currently has a policy that requires officers to, 1, carry, and 2, administer naloxone while on duty. When we look at diversionary policies, I've seen estimates as low as fewer than 5% of all law enforcement agencies in this country are currently operating such a policy. And when we look at the medication treatment, up until some federal legislation that was enacted a couple years ago, it was about half of all drug courts in this country even permitted their use. And estimates now show that not everyone who is opioid use dependent who ends up in the system or has OUD is being provided access to buprenorphine, to methadone, to naltrexone, and to effective forms of treatment. Next slide, please, Weston. One of the biggest barriers that we hypothesize to the full implementation of some of these evidence-based responses that I just went over is stigma, both socially in the community and then provider-based, held by professionals in the criminal justice system. And stigma, just broadly speaking, there's a definition on the screen there. It refers to social ostracism of persons who have a socially undesirable attribute or characteristic. And there are different dimensions or different concepts under this umbrella of stigma: perceptions of dangerousness, blame, fatalism, social distance. Whenever individuals hold these beliefs, we've hypothesized, and as I'll talk about here in a little bit, we found that they influence occupationally driven responses, or how people are processed in the system. So next slide, please, Weston. So just looking at some of this research, we found that stigma, both social and held by providers, influences support for harm reduction, such as support for naloxone carrying policies. It's also been found to influence support for medication assisted treatment and how that's used and who it can be used by. Some of our more recent research has looked into the influence of stigma on sentencing recommendations, treatment availability, and ultimately how individuals are being processed and handled in the criminal justice system. Next slide, please, Weston. So this image here on your screen is from a study that I did a few years ago that examined officers' anticipated responses to overdoses. So we gave them a vignette survey, and we asked them what they would do if they encountered someone who experienced an overdose. Would they administer Narcan? Would they call for medical help? Would they render medical aid? There was a series of responses we gave them. And we found, as hypothesized, that officers who held higher levels of stigma were less willing to provide a full range of services. And we also found that these concepts interact with each other. That if you see on the screen there, at mean level, which would be the solid line there, and then the line just below that, so mean, and then one standard deviation below the mean in terms of blameworthiness, responses are pretty stable. But once fatalistic perceptions are also held with blameworthiness, there's like a compounding effect, that these things interact with each other, and they can also exacerbate the level of care, or the lack of care that officers are willing to provide in such situations. So next slide, please, Weston. And then this image on the screen here is some of the more recent work we've been doing, looking at sentencing recommendations in simulated jury decision makings, and we can see how each one of these concepts is related to more punitive treatment, how perceptions of dangerousness, blameworthiness, fatalism, and desire for social distance can incline simulated jurors to want longer sentences. And this can become problematic whenever it enters the system, right? Because when people are being processed, whenever they're being prosecuted, whenever they're being sentenced, we should rely on legally relevant variables and not variables that shouldn't be considered, such as stigma. So moving forward, we're looking at examining some of these policies a little more carefully, seeing how medication-assisted treatment is being used, how it's being offered in the criminal justice system in in Pennsylvania and the United States more broadly. We're interested in looking at law enforcement naloxone policies, and how stigma may be related to some of these policies that we are seeing in the system. Also, as Dr. Kensinger mentioned at the beginning of the presentation, we've been working with the Pennsylvania State Police recently to hold a series of crisis management trainings. And our hope in these trainings is to get the professionals from the Pennsylvania State Police Academy who are experts in crisis management. We're hoping to get them out into the community and making trainings freely available to municipal police officers, first responders, and community members. So if they encounter a crisis situation in which someone is using drugs or mentally ill or something like that, they will know how to effectively respond to that. So next slide, Weston. And that's everything that we have for you today. I would now like to open up the floor for any questions.
Hey everyone, John Petishnock, just jumping back in here. Just wanted to say thanks to Dr. Kensinger and his research team for such a thorough presentation. We didn't mention this at the top, but the virtual speaker series connects Penn Staters to superstar faculty members at Penn State and our Commonwealth campuses, and certainly this team here is no exception. And when we've got a list of questions to run through, and we'll get to as many of them as we can. Weston, I'll kick it over to you, and then you're welcome to kind of facilitate that as you want. We'll start with, since the center was created, what are one or two areas where you've made significant strides and are maybe points of pride for you?
Obviously just engaging state, local officials, right? There's definitely a crisis. And engaging them and being able to, develop programs and campaigns that really address this, and then bring in more funding for the center. So like I mentioned, the center was established with a $2.5 million leadership endowment. In the last 6 years, I think we brought in a little over 10 million in other external funding to really do the work that we do. So it's really great to see, the combination of teams working together at the community level, at the state level, to really make an impact in reducing substance use disorder, across the Commonwealth. And we've been focused on the opioid epidemic because it's been in the headlines. But we do, work with nicotine, alcohol, stimulants. So we do a lot of things.
With the center being described early on, as you said, as hands-on, how much does that approach resonate with you and your team? How much does that impact, just the day-to-day work that you do, knowing that, yes, there might be philosophical discussions, but you are getting your hand dirty and really getting things done?
Right. Yeah, it drives everything that we do. Before we embark on any new project, we always ask ourselves, right, how is this going to help? Right? The purpose isn't just to put out another research publication. It's not just to get more funding, right? But are we able to, develop a project, work on a project that's actually going to save lives across the Commonwealth? So we're not afraid to get our hands dirty with this. We're out in the community, across the state, working hand in hand with, law enforcement, EMS, community organizations, government leaders to really address this.
One of the things that was mentioned during the presentation that at least resonated with me deeply was when you shared the quotes from the students and how much they had learned in different ways, kind of going along that, with the hands-on approach. What is the significance of those student quotes for you? You and your team talked about that a little bit, but I'm just wondering, when you're able to connect with students on that deep of a level, how much does that motivate and inspire you as you're going about your business?
I'll let Chris and Övgü take this one because they work hand in hand with students.
Yeah, I can start. I mean, I can say that working with our lab students has absolutely been one of the most rewarding experiences for me as a faculty member, because we really get a lot of time to get to know these students and to help them develop skills that they wouldn't necessarily develop along the way, right, as part of their college education. And, I think that Chris and I have talked a lot about how we not only want to train students in research, but we really do want them to become kind of interested or have like more of a stake in addiction research. And that was kind of our goal, but we didn't necessarily know if it was going to happen or not, right? So I think it's been great to know that we have a number of students, like, for example, two of our students who are going to community award accepted to adopt programs are going to be pursuing addictions research. And other students have talked about that as well. So knowing that their experiences led them to want to kind of stay in this field. And this work that's just the best case scenario for us.
Yeah, and I'll add, being able to work with students on their interests and be able to combine the academic aspect, what they're going to school for, and their own interest in substance use disorder is really heartening. A lot of our students do know people, family, friends, maybe themselves sometimes, who have used substances and who may be in recovery, and they're looking for ways to help, to address. A lot of times they've got their own personal experiences dealing with it and supporting people, but being able to combine the academic and the personal experiences to give them another route to address this problem more globally by doing research, by intervening, by engaging in programs with community partners, really helps us to see kind of how successful they can be in their career trajectory. And being able to kind of meld those two pieces, in my mind, makes them better researchers, better practitioners.
Absolutely appreciate the questions there and the answers. So if you're listening in on Zoom, you can drop your questions in the Q&A. We've got a question from our folks tuning in. Eric is asking, how does a current graduate student get more involved with the ACE lab, and where is the lab physically located? Thanks, Eric.
So our lab is physically located at Penn State Harrisburg. So we have a lot of local students who engage with us. We're also open to students who are not in the area to engage. A lot of the work that we do with our students is secondary data analysis and can be done virtually or long distance. So if you're interested, please reach out to either myself or Dr. Kaynak. Send us an email. We're happy to work with you to get you involved. And we enjoy working with any students that we can.
And then to follow up on that a little bit, or just kind of the work in general, you talked a lot about just collaborating with local law enforcement or all kinds of organizations in Pennsylvania. How important is that collaboration when you look at kind of what it'll take to further remove the stigma and really bring as many people as possible into the discussion?
So I think when we're talking about law enforcement in particular and reducing stigma in that community, you have to have buy-in. And one way to get buy-in is by having multiple agencies approaching these issues, right? And we're fortunate that the Pennsylvania State Police is one of the, I believe it's top 10 largest organizations from a law enforcement perspective in this nation. And it's, in my opinion, one of the most professionalized. There's a lot of good stuff going on down there. We've developed a good relationship, and now we're partnering with them. I think that's been able to help us attract some of the municipal departments that may not have been as receptive to some of these ideas and these trainings in the past. Maybe bring them in more now that we have the state police who are working with us there.
When you look ahead at the direction of the center over the next couple of years, is that, I was going to ask you what are one or two areas that you've identified as key areas for the center? So whether it's continuing those discussions, Weston, or maybe even another area, when you look at the next 18 to 24 months, where do you see the center, hopefully continuing to make strides?
Yeah, I mean, definitely continuing the great work that the team's doing. We've been fortunate to have continuation of projects and buy-in from multiple organizations and agencies. A lot of times these organizations come to us for help or to collaborate on projects. Eric has been working with some EMS professionals to get a program going for them, evaluating naloxone effectiveness and things like that. Erica, do you want to mention a little bit about that?
Sure. So thanks for your question, John. I think that we have projects that are already established that we're really engaged in. And then of course, like because of our networks, because of the work we're doing, we're often approached by, kind of partners that we collect as we go through this work, right? Like through conferences, through activities. We're like, hey, connect. Like there's nothing going on right now, but I'll keep your business card in my back pocket. Like hopefully we can connect in the future. And then an opportunity arises where they're like, hey, I'm going to apply for this grant. Would you guys evaluate a training for EMS professionals for us, right? Or would you evaluate the effectiveness of a peer review project on treatment programs? So like we kind of get looped into the fold and kind of brought in. And I think that's what makes the work we do so great, is that like we're consistently and constantly building these connections through just interactions with things that we're doing with students, with faculty, with staff, the university at large, community organizations, and then it just blossoms into something really good. And I think that just leads us to new opportunities and activities. So I think, as Weston mentioned, like we have planned activities for the next 18 to 24 months, but we also like will likely pick up, right, some things or some people along the way because something happens, something changes, and someone thinks of us in a way that we can assist or help or connect other people.
Yeah, that's
one of the things that, you know, is remarkable about people coming to us is they realize our passion for this. Every member of this team is super passionate and motivated about what we do on a daily basis. And we're having those informal discussions with them, you know, seeing them at conferences, seeing them out in the community, that really shines through. And I couldn't be more proud of the team members that we have because they really make it work. And again, it's not any more of us going out and seeking, right, projects, right? People are coming to us now to engage with us because of the great work that we do.
Well, how much does that validate the work and the research that you're doing now that people are coming to you, Weston?
It's extremely validating, right? That people, you know, are recognizing us as experts. The Life Unites Us Stigma Reduction campaign that we started 4 years ago is now a model for the nation. So we published on it. We're working with national organizations, and there's other states that are adopting our model of the campaign to use in their own state. So it's really validating, but there's a lot more work to be done, right? We're never going to, you know, end all deaths, right, associated with substance use disorder, right? But if we could reduce them, that's what we work for every single day. And that's the motivation because I know I mentioned, you know, my best friend died of an overdose. We all know somebody with a substance use disorder. And I think stat just came out, 25% of children are now growing up in homes where one of their parents has an alcohol use disorder. So this is a problem that's going to be going on. We really just work on a daily basis to do the best we can and take the skills and resources that we have, you know, as individuals, but also as a university, right? And pulling in people from Penn State Hershey, SSRI, the CSUA, and researchers from across the Commonwealth to really make an impact in reducing substance use disorder.
You and Erica kind of led into my next question. You mentioned the university a couple of times. You're at Penn State Harrisburg. We just surpassed 800,000 Penn State alumni with the spring graduation the other week, which is a big number. I mean, we always love to tell, you know, the Penn State Alumni Network. Being part of that Penn State Alumni Network, when you're talking with, you know, alumni, your colleagues in Harrisburg, just wondering, you know, like on the day-to-day conversations that you're having, what are you hearing from them about the importance of the work that you're doing, you know, how they can get together? You've kind of talked about this a little bit, but being part of this Penn State network, how does that maybe impact or facilitate the importance of the work that you're doing and give you opportunities?
Yeah, so I'm an alumni of the university, as is Övgü, Erica, and Nathan, because it's the odd duck out. He's been here for 6 years, so he knows it very well. So there's that initial bond, right, as a Penn Stater. And I see it, you know, people come up to me when they find out the work that we're doing. It's not an easy conversation to have for a lot of them, right? Because that stigma is there. But I can kind of, you know, tell when somebody's kind of lurking around a little bit, right? They have a question for me. Maybe they need resources for themselves, right? Maybe, you know, they need to get Narcan because they have a friend or family member, right, who's using substances, right, or fentanyl test strips. But people come and approach us all the time about it. And again, there's that, you know, Penn State bond, right, as alumni that we have. But it also highlights how, you know, as Penn Staters, we work to help people, right? I think it's kind of, you know, in our DNA with what we do on a daily basis. So, you know, it's a work that my team's doing and that the center's doing, right? But it's also, you know, work that alumni is doing, right? When they might not even know they're doing the work out there. But just linking other people to us as resources.
Just to add on to that, I think that there's so many people at Penn State doing addiction research and related fields, right? So I think another kind of added benefit, right, is that so for example, we have somebody come to us that are really interested in like naloxone vending machines. Oh, well, like Hershey Med already has a program. We can connect you with them. So like you don't have to reinvent the wheel. You can, see what they've done, what worked and what hasn't. So I think kind of being part of that network is definitely really helpful. So we can also connect people that we know are doing adjacent work or similar work, maybe not quite where we are, but might be able to help somebody else out in that connection. So I think that that's also really valuable as well.
Yeah, I'll add too that I think just the Penn State name, because so many people across the Commonwealth have had, like they either have a campus in their own town or close by. They know it's a trusted name, right? So, and so many people have had really good experiences with Penn State. So I think that also helps facilitate our research, and that people are willing to collaborate and work with us because they know that we're not a university that comes in, does research and leaves, right? Where Penn State is there and, stays within the community and continues to do good work, and isn't just kind of in it for a little while and on with it out.
Just a couple questions to wrap up then. We're coming up on an hour. And so, again, thanks to Dr. Kensinger and his research team for joining us. Thanks to everyone for tuning in. You touched on this a little bit. Beyond the presentation that we're having today, we'll share it on our communication channels. We'll share it in our newsletters that go out to members and also to all Penn Staters. If someone's tuning in now, or maybe they see this, tomorrow or next week, and they hear about the center and they go, boy, I would really like to get involved in some way. What are some, starting points for them, or what's your advice to them about how they can get, just more involved with the center, or even just learn more, and, you've got them fired up and they want to figure out how they can get involved and help?
Yeah, thanks. Definitely check out our website, the Pollock Center website, which lists our projects. Look at the work that we're doing with Life Unites Us, lifeunitesus.com. I think we shared over 300 stories of Pennsylvanians from across the Commonwealth struggle with a substance use disorder. So just understanding kind of the work that we do first, and then secondly, contact us, right? Reach out. We are always here to help. And if we don't have the answer, or we don't have the exact resource, right, somebody on our team is going to work to get that resource for that individual. Or if they want to partner with us, if it's graduate, undergraduate students who want to do research, reach out to, Dr. Kaynak, Dr. Whipple, and they'll get them involved in that. Or if someone just needs help, right, that's what we're here for, right? So reach out to us and we will find resources for you.
Yeah, as you said, it's not always an easy topic to talk about, but Penn State does have resources here for you, and this is a clear example. I thought it might be a little lighthearted or fun way to wrap up. I thought we could go around the horn and just everybody could mention how, they got to become a Penn Stater. You said, Weston, a lot of you are grads, but, maybe, what inspires you to become a Penn State student, or what inspires you to become a faculty member here? I thought that could be fun, just give folks a chance to know a little bit more about each of you.
Yeah, great, thanks. So I'll start. So my grandmother was the class of 33, right? So it's been in my blood. But it was almost too much in my blood. And growing up, I was not a Penn State fan at all. I did my undergrad in Virginia, but I came back here and didn't really know what I wanted to do. I just knew that I wanted to be back and give back to the community. So I was, we'll say, arrogant. I applied to graduate school here at Penn State Harrisburg, walked into my advisor's office, and he said, "Where do you see yourself in 10 years?" And I smiled at him. I said, "Sitting in your chair." And I am sitting in Rafi's chair. So I completed, my master's here, went to Oklahoma State, did my PhD work, came back, taught in New York for a few years, and the position opened here at Harrisburg. I applied and I was fortunate enough to get the position. And Rafi moved up, right? I kind of took his role and he's moved up again. I've kind of moved up. So Yeah, it's kind of my Penn State story, I guess. But Erica, Övgü, Nathan.
Sure, I can tell mine. So, my family immigrated here, when I was a kid. My dad actually, brought us here because he got a faculty position at Harrisburg marketing. My sisters and I kind of all went to Penn State because for that faculty discount. I continued my studies in the state of Pennsylvania. I went to Penn and then went to Temple. But I knew that I wanted a small campus, as opposed to kind of some of these bigger campuses and that, where I worked at in the past, and I really liked this area and I wanted to come back. So I was lucky enough to have great timing and that there was a faculty position open when when my family moved back here. So I was really excited to kind of do like full circle. So you can say in and out function everywhere.
I feel like you guys have really like exciting stories, and mine's just not like that, right? So, like most Pennsylvanians, grew up watching Penn State football, had family who are fans. Did my undergrad at Lock Haven, and developed an interest in community and public health. And living in this area, growing up in this area by reputation, the College of Medicine is just a really great institution. So went there for my master's degree and worked at some places and found the position at the Pollock Center that really kind of combined a lot of things for me. So the research and evaluation components and also kind of the community engagement things, and they all play together really nicely. And I'm just really fortunate to have found a position that really encompasses all that. And of course, I work with a really great team. So that's an added bonus.
So I was born and raised in Blair County. Penn State Altoona was right in my backyard. When I was looking at schools and I graduated high school, I did a tour of Penn State Altoona, and it was sold to me that this is a world-class education at a fraction of the cost. I could live at home. So that was a no-brainer for me. I did 4 years here. While at Penn State Altoona, the mentorship I received was world class in my opinion. I got involved in research. That's where I fell in love with research. It's where I decided that I wanted to do this with my life. So fast forward a couple years, I went to IUP, got my master's, got my PhD. Whenever I saw there was an opening at Penn State Altoona, I had to come back. This is my dream job. I love the area. I love the community. And I just wanted to work with students like I was worked with years ago, help mentor them, help develop them, and just give back.
Yeah, so I did not go to Penn State for any of my degrees, unfortunately. I grew up on the West Coast with brief stints in Texas, Ohio. I almost made it to Pennsylvania. I was in Cleveland for a while, and then Chicago before this. But my wife and I, after I graduated, we were looking for jobs. Penn State Harrisburg was hiring. I knew nothing about Pennsylvania. I'd never visited Pennsylvania. Didn't really know where Harrisburg was. I knew it was the capital. That was about it. But looking at the job description, it fit really well what I was trying to do. And then looking more into the area, it fit what we wanted for our family, providing opportunities to put down roots, to be close to state and local government, opportunities to be kind of at a nexus of lots of opportunities throughout the Northeast was great. So while I don't have any roots in Penn State, my plans are to stay for the foreseeable future. So I'm happy to be here.
Yeah, but Chris, what you don't know, right? And I just thought about this. I was on the search committee when we brought Chris in, and he was such an all-star candidate that we got his flight canceled and trapped him here. But true story, he was just supposed to fly out. We had some snow and they canceled his flight, so we had to make arrangements. Keep him here a little bit longer, and longer turned into, I guess, what, 6 years at this point. You couldn't be happier with him here. So we trapped you, Chris.
I think that's the perfect way to wrap up this lunchtime discussion. Obviously, Weston, the work and the research that you and your team do is critically important. Let's keep the conversation going. And for folks tuning in, you can visit our website, alumni.psu.edu/events to check out more of these presentations with Penn State superstar faculty members. And we'll be sure to share this conversation far and wide. So appreciate everybody from the center joining us today, and we are. Thanks, everyone.